Hi, how are you?
Hi, I'm okay. How are you?
I'm good.
Good.
So, before we start, I would like to ask is there anything I can do to make you feel more comfortable?
Um, no,
No coffee, nothing,
yeah,
water, no drink?
I'm good.
Okay, so I'm going to be asking you some questions and do feel free to interrupt. If you don't understand anything, you can tell me, say, oh, can you repeat that? Or if I'm speaking too fast, ask me to slow down. I'll be more than willing to do that.
Okay.
All right, so what brings you in today?
I've been having a lot of pain in my belly, and it's been happening for the past 3 days. And yeah, I just wanted to stop.
Okay, for the past 3 days. So, you say it started in the past 3 days. So, can you tell me what were you doing when you
Yeah,
started?
I was just at work, and then I just had like a sudden pain in my belly.
Okay. So, was it gradual or all of a sudden? You said suddenly, right?
Suddenly, yep.
Okay, sudden pain. So, is this pain? Is there anything that will make you feel better or lessen the pain?
I haven't tried anything that has made it better, but at night it does get a bit worse.
Also, night makes it worse.
Hmm.
Okay. All right. So, if you say, oh, it's worse, how can you grade out how worse, bad it is?
Yeah, it's pretty bad at night. It hurts a lot.
Does it stay constant in the same place? Or
Yeah, constant pain.
okay. So have you ever had this pain before?
No, this is the first time.
Okay. So if I were to ask you to describe this pain, would you say it's a sharp pain, a dull pain, or say something that's just kind of like stabbing?
Yeah, it's a sharp pain.
Sharp pain. Okay. Does it move from place to place, or is it just in one specific area?
It's just in one place.
So if you could rate this pain,
Hmm.
with one being the least pain you've ever felt and 10 being the worst pain you've ever felt, how would you rate this pain?
Out of 10, it would be an 8.
Oh, okay, all right. So can you show me exactly which part of your stomach is the
Yeah,
general? Which can you just point
it's
to it?
it's right here, like
Okay.
my right side.
Okay.
Yeah.
Okay. Does it change? Like say during the day, during the night, or is it just a constant pain?
It is constant, but worse at night.
Okay. So besides this pain, do you have any other feeling like symptoms or something like that?
I've noticed that I've had yellowing in my eyes. I noticed that 2 days ago, and I'm not sure if that's something that I should be concerned about, but that is something that I have noticed.
Okay, 2 days ago.
Hmm.
So you started 3 days ago with stomach pain, and then a day later you started feeling, uh, you got to notice that your eye was yellow.
Yeah, not
Okay,
exactly a stomach pain, but kind of like in my core.
abdominal pain.
Yeah,
In your
yeah,
It's just okay.
abdominal pain.
Okay. So can you say what you were doing when the pain, when your eyes, you notice your eyes go yellow?
Yeah, it happened when I woke up. I just noticed yellow.
Okay. Have you tried taking anything for this pain?
No, nothing really makes it better or worse. It's just constant yellowing that I've noticed.
And you have never had this pain before, or yellowness in your eyes before.
No, never.
Okay. So your eyes just remain constant. All right.
Mhm.
So just give me a minute to go over. Let me just recap. You have
Yeah.
better pain for 3 days,
Mhm.
and nothing makes it. The only time you feel a little better is when you sleep. The belly pain.
Uh, yeah, it helps a little bit to sleep, but there's still that pain.
All right. So I'm gonna. And so besides yellowness of your eye, what else do you have? What else do you have you noticed happen with you?
Um, that's all I can think of right now.
Okay. So besides the pain in your belly, have you noticed any recent weight change?
Yeah, actually, I've noticed I've been losing a lot of weight. Maybe like in the past 6 months, I've noticed that I've lost about 10 pounds. And I'm not trying to lose weight, it's just something that I've noticed.
So in the last 6 months, you
Mm.
noticed that. And you're not trying to lose weight, nothing like that. Okay?
Right.
And you notice that, do you have any, how did you get to know that you lost weight? Is it because your clothes don't fit anymore?
Yeah.
Okay.
Yeah.
So I'm going to just, okay. So do you have any kind of allergies?
Allergies, yes. I'm allergic to penicillin. And I had an allergic reaction back in 2002. And I started getting hives. My body started reacting to the penicillin.
And do you take any medication?
I do. I take lisinopril for my high blood pressure, and I take it once a day by mouth, and I take 10 milligrams.
Is that the
That's
only
it.
medication you take?
Yeah, that's it.
So I'm going to ask you about your childhood, and this is just going to be a yes/no answer.
Mm-hmm.
How can you say your childhood was? Can you describe your childhood?
Yeah, it was pretty good. I had a happy childhood. I did get chickenpox when I was a kid. Overall, I had a pretty healthy childhood.
That's good to know. And so I'm going to ask you whether you've had any of these illnesses during your childhood. Did you
Okay.
have measles
No, I did not.
or rubella?
Nope.
Whooping cough?
No.
You said you had chickenpox or
Yes.
rheumatic fever?
No.
Scarlet fever?
No.
Polio?
No.
Diphtheria?
No.
Any kind of psychiatric disorders?
Mm-mm.
Okay, and did you get immunization for any one of these? Polio,
I did.
MMR, mumps, rubella. Did you get the
I
vaccine?
did. Yes.
What's about tetanus?
Yes.
Diphtheria,
Yes.
rotavirus,
Yes.
hepatitis B,
I'm not sure about that.
chickenpox,
I did get a vaccination for that. Yes.
pneumococcal.
Yes.
So in your adult life, I would say your adult life, have you had thyroid disease
Thyroid? No.
or heart disease,
No.
hypertension,
I do have hypertension. Yes.
hypolipidemia,
No.
diabetes,
No.
COPD or asthma,
Mm-mm.
cancer,
No.
HIV,
No.
hepatitis,
No. I don't think so.
any kidney disease,
No.
blood clots,
Nope.
psychiatric history,
Nope.
and did you get your flu vaccine?
I did.
What's about Hep B?
I did not.
Zooster,
I did.
and pneumococcal?
Yeah, I did.
So, have you had any kind of like major illnesses?
Major illnesses? Well, I got diagnosed with hypertension, and they put me on lisinopril. That's about it.
Okay, so that's just an ongoing thing that you have with you.
Yes.
So it did not require any kind of like hospitalizations.
It did not.
Okay.
Yeah. But
Have you
I
had-
was hospitalized back in June of 2012, and it was because I got into a car accident and I got whiplash, so I got hospitalized for that too.
So then I will ask you this. So I can safely say that in June 2012,
Mm-hmm.
you were in an accident
Yes.
and you had whiplash.
Yes.
And what treatment were you given?
I was given pain medicine and I had to go to physical therapy for about 3 months.
Is that the only accident you've ever been involved in?
Yes.
Okay, so hospitalization, can you say that you were hospitalized for the same accident?
Yes.
Okay. And besides that time, there's never been any other time you were
No,
hospitalized?
that's been it. Yep.
Okay. Have you had any surgeries?
Surgeries, yes. I had an appendectomy in July of 2015.
So it was, you were diagnosed for, you had appendix, and it was removed
Yeah.
in July of 2015?
Yes.
What hospital and who was the surgeon?
The hospital was Jefferson, and the surgeon was Dr. Thomas.
Were there any complications?
No
Or was it-
complications. Yep, full recovery.
Okay. Okay, so no surgeries, nothing besides that.
Nothing besides that. Yep.
Okay, so I'm going to ask you about some illnesses. Do you have high cholesterol?
I do not.
Mammograph? Have you been seeing a doctor to take your mammogram?
Yeah, I did in 2016.
Okay, and what was the result?
Everything was fine.
Do you remember the exact date?
I don't remember
Like
the
just the month?
May, maybe. May,
And there was no diagnosis.
yeah. Yes.
Have you ever had tuberculosis?
No.
Lung cancer screening? Have you been screened for lung cancer?
Nope.
Colonoscopy?
Nope.
Fecal occult blood test?
No.
Pap smear?
Yes. In 2018, I got a pap smear. So earlier this year in April, and the results were fine. Nothing out of the ordinary.
So can you tell me when you got your first menses?
I got my first period when I was 11 years old, and that was 2007, yeah.
Okay. Do you know the length and regularity of the cycle?
Yeah, so I get my period every month, and I get it for exactly 7 days, and it's like a medium flow, not that heavy, but yeah.
So the last menstrual period was when?
Last menstrual period, it was earlier this month, so around September 1st.
Do you have any kind of like painful menses?
No.
Okay. A pap smear, you say you had a pap smear.
Mm-hmm.
Do you have any kids?
No, I don't.
Have you ever been pregnant?
Nope.
Have you miscarried?
Mm-mm.
Do you take contraceptions?
No, I don't.
Are you sexually active?
I am not sexually active.
Okay. So that means you have no partner. So you've not had any new partners in the last 6 months?
No, I'm single.
Have you had any history of STIs?
Nope.
So at home, you feel safe, right? As a person at home and everything?
At home?
Yeah, you feel safe.
Oh, I do feel safe at home. Yeah, I live by myself.
And, okay.
Yeah.
Do you have any concerns or question right now?
No, I don't.
Have you had any kind of psychiatric evaluations or reason to be diagnosed like illnesses?
I don't know. I don't think so.
So can you tell me about your family?
Yeah. So my dad, he's 67, and he was diagnosed with coronary artery disease. He also has diabetes. My mom, she's 65 right now, and she has hypertension as well, same as me. My grandpa, he died from a stroke, and
Who was your grandpa?
he was 76 when he died from a stroke. And my grandmother, she is 88 and she's living. She has breast cancer and arthritis.
Okay.
Oh, and also I have siblings, or one sibling. My brother, he is 35. He doesn't have any illnesses, but he is allergic to eggs and peanuts. That's
Okay.
it for family.
All right. And you, how many years old?
I am 25 years old.
And you have hypertension.
Yes.
So in your family or your siblings, do you have anybody with any of these illnesses? Headaches,
No.
seizure disorder,
No.
stroke,
My grandpa did, yes.
mental illness,
Nope.
suicide,
No.
substance abuse,
No.
thyroid disease,
No.
coronary heart artery disease,
Yes, my father had it.
hypertension,
Yes, my mother had it.
hyperlipidemia,
No.
diabetes,
Yes.
asthma,
No.
tuberculosis,
No.
renal disease,
Nope.
arthritis,
Yes.
allergies,
Yes.
cancer,
Yes.
genetically transmitted diseases.
No.
Okay, so can you tell me where you were born?
Yeah, I was born in Orlando, Florida.
The perception of the child, you already said that the child was good.
Yes. That was pretty good.
So what's your last year of education you completed?
I graduated college.
So you have a bachelor?
Yes, I have a bachelor's
In what?
in marketing, and now I work in an office job full time. Yeah.
Okay. So your home situation, how is your home like?
I live by myself in an apartment.
How many stairs do you say you have before you enter your apartment or your building?
There's no stairs in my apartment.
No significant other.
Mm-mm. Yeah.
Do you have any sources of stress?
Yeah. I think I have a little bit of financial stress because I'm just trying to pay off my student loans. But other than that, no other forms of stress in my life.
Okay, that's good. Have you ever served in the military?
No.
So your financial situation,
Mm-hmm.
how can you describe that as well?
Yeah, it's just since I'm living by myself and paying my own rent and kind of being more independent, I'm kind of struggling with balancing, like paying off my student loans and also trying to live day to day in an office job and paying for like lifestyle.
So,
yeah.
will I be accurate if I were to say, oh, you're trying to make ends meet?
Yes, trying to make ends meet.
So what do you do for leisure activities?
I go to the bar every day after work and have some drinks with my friends. And that's just how we kind of de-stress, I guess.
Okay. So, are you able to bathe yourself?
Yes.
Can you do your own dressing,
Yes.
toileting,
Yes.
transferring?
Yes.
You're continent, right?
Mm-hmm.
Bowel movement's good.
Mm-hmm.
Feed yourself?
Yep.
Can you use the telephone by yourself?
Yes.
Do you do your own shopping?
Yes.
Prepare your own food?
Mm-hmm.
Your own housekeeping?
Yes.
Laundry?
Yes.
Do you drive or do you driven by somebody?
I do drive, yeah.
Do you take any meds? Do you
they're
need help
less-
with taking your meds?
Oh, no.
Take your meds. And you manage your own money.
I do, yes.
What's your religious belief?
I am not religious. go.
What? No.
We're still going. No, we're still going.
It's not 25?
Yeah.
So you're non-religious.
Yep.
Do you exercise frequently?
No, but I probably should.
So do you do some exercising?
So I don't exercise, but I probably should, yes.
Okay. So how would you say like your food intake? Yeah, breakfast, lunch, dinner.
I don't really eat that much. I maybe eat like one meal a day, but yeah, I just don't really get hungry.
Okay. How's your fluid intake?
Fluid intake? Mostly alcohol. I guess.
Okay. So, all right. So you water. Do you drink a lot of water?
Water, not as much as people telling me. Like the amount I probably should drink water.
So if you say you drink,
Like,
how many ounces per day would you say you drink?
maybe like
A bottle, 2 bottles. That would be 16 ounces. Like the smaller bottle or the
yeah,
big bottle.
16 ounces.
So, just sleep habit. How many hours of sleep do you get?
I don't really get that much sleep. Maybe like 4 hours per night.
Do you wear seat belts?
I do.
Do you wear back helmet whenever you go biking?
Yeah.
Do you use sunblock when you go out in the sun?
Mm-hmm.
Do you have smoke detectors in your house?
I do.
Do you lock your cabinets for your medication so you keep it safe?
I don't, but I live by myself, so I just keep it out.
Do you have firearms?
I don't know.
Okay. Do you practice alternative healthcare practices?
Nope.
Have you ever taken do you smoke?
I do not smoke.
So what's about alcohol? Do you drink alcohol?
I do, yep. I drink. So after work, my friends and I like to go to the bar, and they always pressure me to drink. But I would say I drink maybe 2 cocktails and 2 beers per night.
Okay. Do you drink on weekdays too?
I do.
Do you use any kind of illicit drugs that has not been prescribed?
No.
So now, I'm going to ask this question. There are almost like 100 questions, so
Okay.
it's just going to be yes, no. So, what's the usual weight?
It's usually 130, but now it's been 120.
Have you noticed recent weight change?
Yeah.
Clothing that will fit tightly or loosely than before. Have you noticed anything like that?
Yeah, more loosely.
Do you experience weakness,
Mm-hmm.
fatigue,
Yep.
fever?
Yep.
Also, do you have rashes on your skin?
No, I don't.
Lumps?
Nope.
Sores?
No.
Itching?
Uh-uh.
Dryness of skin?
No.
Change in color of the skin?
Nope.
Change in hair and nails?
Nope.
Change in the size of or color of the mole?
No.
Do you experience headache?
Mm-mm.
Have you ever had a head injury?
No.
Dizziness?
Yeah, I do have dizziness.
Lightheadedness?
Yeah.
How's your vision?
Vision? It's good.
Do you wear glasses or contacts?
Yeah, I do.
When was the last eye exam you had?
I had it last year when I went to my doctor and I got my eyes. Oh my gosh, I'm sorry. My contacts, it gets really it irritates my eyes, so my eyes start to water. I'm not crying or anything.
Okay. All right. Do you experience pain in your eyes?
No, no, not my patient.
Any redness of your eyes?
No.
Do you have excessive tearing?
Yep, excessive tearing right now. Yeah, it's 25 minutes.